Dr. Shawn Griffin. I'm the president and CEO at URAC, and we're just thrilled that all of you have come on board here. We're going to get started with this. So go ahead with the next slide. Behind the scenes, I've got my team running things. Technical issues, message Lisa Silverman or Nick Davis. We are recording this, as I said. We'll get a link to you later this week. Introduce yourself in the chat box. Tell us what organization you're with as we get into this topic. So go ahead and next slide, please. What brings us together today? Well, the focus of this is mentally healthy workplaces are the future of work. And we are thrilled that Dr. Kathy Pike will be joining us in a little bit here. But really what we're going to talk about is the fact that we know that having a healthy workplace and a mentally supportive workplace is incredibly important, both for productivity, but also for taking care of our most valuable resource, which is the people that we work with. This is something that we have been strongly committed to at URAC since for years now. I've been the CEO now for over 5 years. And we really recognized, before the pandemic and also during the pandemic, that life is pretty stressful. We have a lot of things going on. People are burned out. People are stressed. People have life issues that they bring to work. And one of the things that we say is we really feel that your 8 hours of work should support your 24 hours of life, and they shouldn't take away from it. We think that work can be a place where we care about people and where we protect people. And we're going to go more in depth as we cover things for this talk today. But first off, we're going to do a poll. And what we're doing with this poll is we're actually wanting to know sort of what area you represent. Are you here are all the choices, and you can scroll down if you don't see what you're particularly from. But what we're looking for is what industry do you represent? And this is really important because we know that having a mentally healthy workplace is not something that's just limited to education or healthcare or in manufacturing. As we have been involved in this process for several years now, we have seen great organizations from across the spectrum care about their people and change to support their people and work on having a mentally healthy workplace. And the really exciting thing about the work that we're doing here, if you could go ahead and fill out the polls, and we'll give it a little bit more, and then we'll bring up the poll results, and I'll have Kathy come on here and join me, is that we really think that the opportunities and things that we're going to discuss today really reflect evidence-based, positive, supported methods for improving your workplace, for improving what you do for your people. And we recognize that being a mentally healthy workplace is not just about benefits. It's about so many other things also. Overwhelmingly today, we have healthcare services and products here, but we also have insurance, we have retail, we have consumer services, computer services, and hardware. Kathy has now jumped on board here. Kathy, when you look at this list and you think about the industries that we have on here today, recognize that URAC traditionally has been sort of focused in health services and products. What are your thoughts on the people we have gathered around the campfire today?
So thanks so much, Shawn, and good to join you. A couple of reflections. Clearly, the sampling bias is that we and URAC has been focused on healthcare and insurance organizations. So that represents a lot of the folks who joined us. But every industry on this list has to figure out how to do the work of work. And as we work in this area and work across industries, what we see is that there's some very common denominators across the workplaces around what matters in terms of advancing and supporting mental health in the workplace, and then some particular industry risks and critical points of focus. So given the concentration of folks here in the healthcare industry, I just want to shout out that for the healthcare industry, this topic is many faceted because mental health and addressing the mental health issues is often led by people who have healthcare backgrounds. The mental health issues within healthcare service delivery are really serious now, and we're seeing all kinds of mental health, particular psychosocial hazards and risks for this group. So I think we're going to have a lot to talk about today.
I appreciate that, Kathy. Yeah, I was part of hospital systems for a couple of decades, and I was a chief medical information officer. And really, sort of, I have colleagues who are still back in my office in Missouri or that I worked with in Texas who will talk about burnout, who will talk about the mental burden and all of these sort of things that sort of came to the forefront during the pandemic, and the daily dealing with deaths and those things. And we've seen efforts, whether it be magnet status and some of the changes that we see there. But one of the things that we thought about at URAC as we were looking at this is that it's not just about the people who are at the bedside. It's
That's
about the
right.
people who are at the registration desk. It's about the people who are driving the ambulance. It's about all throughout healthcare. But then it's also about police officers. It's about I have a son who's in law school. It's about the new partners at the firm and those sort of things. And we've really just seen that's why this is a need that we see across industry in so many different ways. I'm going to just cover a little bit because we have so many organizations on here today that may know URAC, may not know URAC. I want to give a little bit of our history. URAC has been around for over 30 years. We are a healthcare accreditation organization, was our primary focus. We now do accreditations in general. We believe that accreditation is about educating and improving situations, bringing in best practices. And then we also act as an auditor. We come in and the accreditation is to say, all right, you say you're doing things, but are you doing them day in, day out? And we write programs. We work with partners. Our partners are everything from Amazon to Blue Cross Blue Shield Association, insurance commissioners, Office of Personnel Management. We really are a multi-stakeholder group that convenes organizations to bring together best practices, and then we accredit organizations for achieving them. And we know that the expertise that Kathy and her background and the One Mind group bring to this work is such a core to us doing this program in the right way. Because if you're going to put the efforts into building your organization and to taking care of your organization, we want to make sure that it's worthwhile. So one more slide, and then I'll be turning it over to Kathy to talk about some things. So accreditation is an independent review. To people of my age, we talk about the Good Housekeeping seal of approval. To younger people, it might be Angie's List or those sort of things. But also, anybody who's familiar with finances, it's the independent audit. It's someone coming in from the outside and making sure that the books match the reality. And that's really what we think is our accreditation is a verification of quality. And we do everything from mental health parity to health plans to specialty pharmacy. And we're extremely proud of our accreditation that we built around this mental health at work program. And so I just wanted to sort of share our background with URAC for those of you who don't know it. For those of you who are familiar with it, I hope you didn't hear anything surprising there. We are nonprofit, we are independent, and we try and make every community get better every day when we have a chance to work with it. So with all of that, next slide, please. I'm going to be turning it over to Kathy here. And I just want to say, Kathy is one of the nicest people that I get to work with as part of my job. And she's not just nice, she's also brilliant. And she has tremendous background and experience. And we thank her for coming on board with us for this webinar today and sharing the work that they are doing at One Mind at Work. And so, Kathy, I will turn over the next bunch of slides to you, and I will listen attentively.
Thanks so much, Shawn. It's really, really a pleasure to join you and to work with URAC to, as you say, the end goal, the target here is to support organizations, whatever kind of industry you're working in, to address the mental health needs, the mental health and well-being needs of your workforce, recognizing they're the greatest asset of an organization, and that when people thrive, organizations thrive. So I'm going to share with you all a bit about One Mind at Work. I serve as CEO of One Mind at Work, and I'm also a clinical psychologist and longtime faculty member at Columbia University in New York City. So One Mind at Work is a nonprofit organization leading a global movement to improve workplace mental health. We have science at the cornerstone of all that we do, and we bring science to build best practice for meaningful impact, for measurable impact on workforce mental health. We do this through a broad membership program and have 140 plus members and affiliates, and we have a range of services that we offer. You can go to the next slide. So what we bring to our membership team is expertise around the science of and content around workplace mental health. One of the biggest challenges that I think the field faces at the moment is that we're inundated with all kinds of product that's being marketed, and some of it's really good and some of it doesn't have the science base that really is going to drive impact. We're committed at One Mind at Work to ensure that we bring expertise and translate science and use science as our cornerstone. We work with our members around education, understanding that mental health and well-being occurs across a continuum that I'll talk about in a little bit, in a couple of slides. We are committed to measurement. One of the big driving forces for the work that we do is to empower and to educate and support decision makers in the workplace so that you can make informed decisions about what to continue to do, what to change or tweak in terms of efforts related to workplace mental health, and what to sunset because it's not having impact. And the measurement is a key piece of that. And the fourth component here is around community. We learn better together and from each other. And so in our membership program, really create opportunities throughout the year, and then a members only convening to hear from scientists, to learn from experience, and to build best practices together. Next slide. So what are we seeing in terms of the global workforce? I think everyone on this webinar will be aware of the critical issues that are occurring around what some people are calling a global mental health crisis. So I'm not going to belabor the point, but as a few reference points, we know that about 15% of working age adults have some current mental health condition. About 60% of workers report that work is having a negative impact on their mental health. The good news is that the majority of workers believe that workplaces can actually have positive impact, and there are decisions that leaders can take that would have a positive benefit. And if we don't, the cost is extraordinary. And the thing to keep in mind here that we say over and over again is that within an organization, you're going to be attending to mental health and well-being, or mental health and well-being will be part of your story, whether you're attending to it or not. If you're not attending to it, those dollars are spent in ways that don't yield positive benefits. If you are paying attention to it, you actually will have tremendous returns on your investment. So let's go to the next slide. What we're seeing is an increased in the workplace. We're seeing an increased focus on worker mental health. But as I said, we're also seeing a proliferation of ad hoc point solutions, and it's just too much. And in the absence of guidance for business leaders, it's hard to know what to do and what works. And that's how we moved to developing the tools that I'm going to share with you. Next slide. So this is this is our garden, and this is the image that I want you to use as you think about the work that we're doing in around workplace. When you are a gardener and your garden has one plant that wilts, then it's really appropriate to look at that plant and wonder what's going on here with this single plant. But when you have a whole garden, when you have the majority of your workforce, or the majority of your tomato plants, whatever it might be in your garden, that are wilting, then you need to look at more systemic solutions. And what we have to date largely are end of the continuum solutions for mental health services. Clinical care is often the point that people focus on. And what we're going to talk about today is an approach that takes us across the entire continuum of addressing mental health and well-being, so that you're not just focusing on a single entity in your garden, but actually looking broadly across your garden and understanding, what do I need to think of with my garden when my plant wilts? Well, it could be when I have a whole garden that's wilting, it could be that I don't have enough water, it could be I have too much sun, could be that I'm in the shade. It could be that I've got too much wind. It could be that the soil's not right. The tool that we've built is going to help you figure out how to read and understand why your garden is wilting. So, and change that. Next slide. So what we're really talking about is a systems approach within the workplace so that you can have real sustained impact and be able to measure improvements for individuals, for teams, for the overall organization. And that translates into better culture, that translates into higher performance and an overall more positive community for the workplace. Next slide.
Hey, Kathy, let me just ask you a little bit,
Yeah.
as the CEO of an organization, I have vendors who come to me and they're like, oh my goodness, you've got to see this thing. This is the new magic wand. This is the survey. And if you do this, everything will be fixed. And here's what you're going to do. And the really bad news is next week I have two other vendors coming in saying exactly the same thing.
Right.
When you think about this, when you think about all of this stuff, and you've been working in this area for quite a while, with the pandemic, how did you see the pandemic sort of feed into this environment around this topic?
So the pandemic pulled back the curtain, right? So the prior to the pandemic, there were organizations that decided that mental health just wasn't going to be a priority, that they were going to put on their organizational to-do list. But the pandemic pulled the curtain back. That made it clear that whether or not you pay attention to mental health matters in your workplace. And if you willfully choose to not pay attention, you're going to be paying a very high price, because the data were very clear and they really exploded during the pandemic in terms of issues around reputation, recruitment, retention, all have due to not paying attention to the mental health needs of the workforce, have huge, huge implications for a workplace and for a business leader. And the other thing we saw, just like you said, Shawn, is then a lot of products, but a lot of products are about endpoint solution. They're not necessarily science-based. We've been really committed at One Mind at Work to put science and put our researchers at the cornerstone of the work that we do, so that everything that we do is about putting data and putting evidence in the hands of decision makers so that you can make well-informed decisions about how to go forward to have real impact.
Yeah, Kathy, that's one of the things that sort of stuck with me. When I first heard about this and I was looking for things with the pandemic. One of the ideas that sort of stuck with me is years ago when you used to see TV shows, and when a person was in prison, if they misbehaved, what did you do to them? You put them in solitary confinement, because that was the worst punishment you could have in prison. And then the pandemic happened and we all went into solitary confinement for months at a time. And it just amplified all of the conditions, all of the problems that we were seeing, and they couldn't be hidden anymore. And I think that was one of the things when I looked at the index, and especially the research behind it and all of the work that you put in it, in the way that this is everything from World Health Organization and frameworks and all these sort of things boiled down into what we're going to talk about next. So I'm really excited to sort of share this work with all the organizations that have joined us today.
Thanks. Yeah, and just to your point, to share with people as we move into what this index is about, as you referenced, Shawn, the foundation of the index was built on a global collaboration of research scientists who work in the area of organizational psychology, of workplace mental health, clinical psychology, social work, a whole range of disciplines related to mental health and safety and well-being in the workplace. And also the other piece about the building this index that I think is critically important is that it was also built in partnership with the founding corporate council of 10 companies, 10 organizations, for-profit, not-for-profit, large and small, who committed to be our thought partners and really test the utility and feasibility and applicability of the instrument and be able to bring the science forward in a meaningful way. So shall I jump in, Shawn, and carry forward on describing
Absolutely.
index?
Run with it.
Okay.
This is the meat of the stuff.
Okay, so let me jump in and share with you all what this index is that Shawn and I are talking about. The Mental Health at Work Index was designed, as I said, with the team at Columbia leading the scientific work in partnership with One Mind at Work, the nonprofit that has the member engagement, and Ethisphere that has technology expertise and methodology expertise about how do you measure and improve critical business functions. So together, we built this Mental Health at Work Index to take the guesswork out of workplace mental health. What does it look like? Let me take you through a bit. The index is a self-assessment, and to underscore, this is a tool for leaders. This is not an employee survey. You do not send this assessment out to all of your workforce. In fact, quite the opposite. It's a tool for a leadership team, and we recommend that a cross-functional leadership team complete the self-assessment, which is about 65 questions. It's an online assessment that asks a range of questions, and we'll get into the details of that in a sec. As soon as you complete the assessment, you hit the submit button and you get back your scores. And your scores are embedded in a report that provides you information about what the target scores are for what a good, mature program looks like in each of the categories that's assessed, what the benchmark scores are, so the scores of all the other organizations that have completed the assessment to date, and the red flag score. Red flag scores are the score below which you're really exposing your organization to risk. But it's not just about measurement. We really want you to have the data so that you can make the improvements, make the enhancements to your workplace that will have real impact. And so once you complete the assessment, you also gain access to an advice library that is a resource hub with 120 some odd resources about how to improve the work that you're doing. And in this customized report, you get a set of priorities. We've built an algorithm to synthesize the key priorities for you that will have the most impact and link those key priorities to the resources that will be most useful. So next slide. I've talked a bit about this idea of working across the continuum, understanding mental health across the continuum. We think it's really, really critical because for the most part, when people say mental health and they think about intervention or addressing mental health, they're thinking about provision at the end of the continuum. But we want to take things upstream and talk about protection and promotion and then provision. So within protection, I think if you click on that, you're going to get a little text there. Yeah. When we talk about protection, we're talking about in the workplace, how do you protect mental health, the mental health of your employees? How do you reduce exposure to negative incidents, psychosocial hazards that would potentially put the mental health of your workers at risk? Then we talk about promotion. What are you doing in terms of promoting the mental health and well-being? You can click on promotion. What are you doing in terms of promoting the mental health and well-being, the skills, the resilience for your workforce so that they are better able to manage mental health issues and better able to respond appropriately when they see that there are mental health needs within the workforce where they operate. And that's also something that we think about in terms of promoting mental health systemically. How are systems and structures at work set up so that they promote the mental health and well-being of your workforce? And then if you get the protection and promotion right, you're still going to have some individuals who will need the provision of care and treatment, clinical care, but it will be a much smaller group and a much more appropriate group for seeking treatment. Right now, we have a bit of a mudslide for the most part, where in the absence of protection and promotion, we wind up with more people winding up needing clinical care and clinical services. Really important in the workplace, really important that you're able to get good information to your workforce when they need it, and good care to your workforce when they need it. But when working across the 3Ps, resources will be much better deployed, and your workforce will be much higher functioning, and the mental health needs will be much better addressed.
Yeah, Kathy, I want to say that when we look at the 3Ps, the conceptual framework on this one, as an old family practice doctor, this really struck a chord with me, because we talk about it's much better to prevent problems than to come in and try and solve them at the end. And I really think this framework idea of looking at how work is structured, how things are set up. You still, like you said, you still have people who have issues and who need to have care and those sort of things. And that's something that we also want to reduce the stigma on, because mental health is part of health. But I think that they're really sort of taking this broader approach, and going at it from the source, is very different than a lot of the point solutions that sort of pop up at the end and talk about how to save you at the last minute and those sort of things. So this was one of the things that sort of I bought into as a primary care physician. One of the things that you mentioned earlier that I just wanted to sort of ask you about, when you talk about systems approach thinking, and you talk about how that comes into this, how would you sort of one paragraph on how the systems approach thinking influences this?
So when we think from a systems perspective, let's go back to that garden. What I'm saying is, as the gardener, I'm looking at the conditions of my garden, right? The big picture questions about what's happening in terms of the sun, what's happening in terms of the wind, what's happening in terms of temperature, what's the content of the soil. That's a systems approach. When we take a individual clinical approach, we'd say, this plant is wilting. What infection is inside this plant? At times, there's an individual that's in trouble, and that's where the provision is really critical. But big picture, when you've got a population when you have a condition that is impacting a large percentage of the population, we need to look at the systems. And that's where, when we look at workplace and we see these very high rates of stress and burnout and turnover and issues around reputation, issues around presenteeism, being at work but not really being able to work, high rates of absenteeism, high rates of disability in certain workplaces. Those are systems issues. And so when we look across the protection, promotion, and provision, knowing where we should be, what kind of question we should be asking, will help inform what kind of solution we put forward.
So it sounds to me like the pizza party and the Starbucks gift card really is not good enough for fixing all of our mental health issues at work.
That's right. You know, the pizza party and the Starbucks gift card are always fun. But what I can tell you is that if the pizza party and the Starbucks gift card are distributed in the absence of a more systemic approach, they will be resented. And I think you see that now. You see people posting and saying, I don't want one more kind bar. And there's nothing wrong with a kind bar, right? But that's not what the issues are. And people begin to resent that and feel like there's an effort to placate them, when in fact there are bigger issues to address, that if you're addressing them, then the pizza party and the gift card are always appreciated.
Okay. I'm gonna let you get through some more of these slides, and I'll be coming back on a little bit.
Sure. So if we go to the next slide, I just want to share with everyone that across the 3Ps, when we think about the protection, promotion, and provision, we're looking at 10 categories of business function that are described here. And one of the things to highlight here is that, as you'll notice, many of the categories don't look immediately like mental health categories, something like work design and environment, or communication. But within each of these categories, in fact, there's a mental health lens and there are mental health factors, and the way you manage or the way you address each of these business areas will impact your employee mental health. So, for example, in terms of communications, Shawn just said something about destigmatizing the conversation around mental health and mental illness, building a culture of inclusion where people can talk about mental health and mental illness. Having the right communications plan makes a huge difference there. In terms of work design, giving people how work is designed physically and how work is designed in terms of interpersonal factors and whether there are appropriate levers in place to, if there are issues around mental health, or there are appropriate options in place in terms of design and agency about how an individual might complete the work that they are required to do, has a huge impact on their mental health and well-being. Simple interventions like, to the extent possible, giving individuals agency about whether they start at 8 a.m. or 9 a.m. Gives people, take for example, young parents who want to drop their kids off at school. They might want to start at 9 a.m., but another individual might want to start at 8 a.m. because they have other family responsibilities in the afternoon. Those are not necessarily mental health interventions, but they have huge impact on mental health. Next slide. So to be a little bit more granular and give you the more detail about what you get with the index and how we use data and how we empower you with data, you get your maturity score. Each of the items is organized on a maturity scale from 0 to 5. And so you get your maturity score for each item, for each category, and then an overall maturity score. You also compare your scores to the target score by item, category, overall. I mentioned the benchmark score of other organizations. And to date, we have a global benchmark for all organizations that have completed the assessment. But as the database grows, we will have the opportunity and the capacity to provide benchmark by industry, by organizational size, and region are the first 3 dimensions by which we want to refine benchmark scores. And then the red flag score, which is a really important reference in terms of risk. The benchmark score is set at a level where if you had an adverse outcome, an adverse event in your workplace related to something in that category, and you are operating below the red flag score, it would indicate that you are potentially exposing your organization to undue risk. So those are key data points that we then synthesize for you to help you develop priorities for your own improvement, program improvement. Next slide. So Shawn said, we've got all of these things that are being marketed and sold to organizations to try to address the mental health needs. The particular features of the Mental Health at Work Index that distinguish what we do compared to other organizations is that the index is not an employee survey. It's completed by leadership. It's a leadership tool. The home of the index is a nonprofit. We are on a mission to create sustainable, measurable impact with organizations that if you come into our membership, we've got lots more programming, but individual organizations can also choose to simply complete the Mental Health at Work Index on their own. We can provide guidance then on how to and support you in terms of coaching in making some of the improvements that are recommended from the index. You've got access to an advice library that's built on all of this science and a strong community of members that range from large multinational corporations like Bank of America and AXA and Aon and CVS Health, all the way to small organizations like a regional seafood distributor in Texas that has less than 50 employees, and including also nonprofits and the educational sector. So a really wide range of members in the community who are committed to learning, using data to share, to build best practices, share experience so that we can, in fact, together improve mental health at work. Next slide. I think we can skip this. Well, let me just say one thing here, which is that one of the key takeaways, and we'll be sharing more about this in the annual report that will be coming out next month. So I believe we'll coordinate with Shawn and his team to share that annual report with all of you about the first year of learning from the index. But one of the key takeaways is that 3 out of 4 organizations do not have a mental health strategy. And, as I think it's Yogi Berra who said, if you don't know where you're going, you may wind up someplace else. So, it's really important to think about that in terms of organizational focus, knowing what it is you're trying to achieve around mental health, and then being able to use good data to guide decisions that give you the authority to, will help you build buy-in to launch new programs, to change how you deliver certain initiatives, and to sunset efforts that are not having real impact. So I think we can go to the next slide.
Actually, let me ask you a couple things, Kathy, before I let you run away. There was a comment in the chat about stigma and bias within the African American community with regards to mental health. Do you have a positive approach to address this issue? When it comes to stigma and bias, what are some pieces of advice that you would have for organizations as they look at that, whether it be in the African American community or whether there be generational stigma and bias? What would you say?
Yeah, the issue about stigma and bias is very real, and it also is very context specific, as the person suggests with asking about the African American, the Black American community. So we work globally, and we know, for example, how you talk about mental health or comfort talking about mental health and mental illness in certain Asian societies, certain Asian cultures is very different from what might take place in an office in London or might take place in an office in Reno, Nevada. And so there are regional differences, there are cultural differences, as you describe here with the Black American community. What we know is that there are very successful programs that you can build around addressing stigma and bias in the workplace that are captured across this continuum. So we are thinking about that in the categories that we referenced around building a strategy. Strategy needs to be one that's clear about intent and language and communication. Around leadership engagement, when a leader in an organization talks about mental health, just breaks the silence and shares a personal experience, whether it's their own or somebody in their family or a fellow worker, the experience around mental health and well-being appropriately, it has enormous positive benefit. Building workforce involvement and engagement so that members of the workforce who represent whatever community it is, maybe it's the LGBTQ plus community, maybe it's the Black American community, maybe it's a community of parents of children with special needs, to build the workforce involvement in telling and sharing what they need in terms of supporting mental health goes a long way in terms of beginning to change the story and reduce the stigma. And it is then ultimately about shifting culture within the workplace and more broadly within communities. And I think it's really important to acknowledge that in the workforce, working adults spend more time working than any other activity in their waking days, in their waking hours. So the workforce addressing mental health and breaking down this stigma in a systematic, scientific way has huge impact for the workplace, but also for the broader community, because somebody works in a culture where you can talk about mental health and they can go home and talk to their family members. They talk to their family members. Those family members go to a different workplace, and it begins to really build a virtuous cycle.
Yeah, I would say we went through the index. We're still in the process. We went through it once. We found our hotspots, those sort of things. We did not have an explicit mental health strategy. So we're like a lot of the organizations. And we had been doing things reflective of a concept of mental health. And we had done some things around diversity, equity, inclusion, and belonging that were complementary to all of this work. But there are some things where you kind of go, well, why didn't you just have a strategy? And it's like, well, we were doing things that sure looked like we had a strategy, but we never had the discussion. So there were some little hot spots there that we could fill in. But this systematic, objective, scientific approach to how to approach this, and not just be reactive and worry about your benefit design or those sort of things, but really sort of stitching this throughout your organization was very important. And I will also, just from a personal standpoint, I've been one of the champions for this initiative within my organization, and part of that is my own history. I mean, I have family history of alcohol abuse. I have family history of suicides, of anxiety, of depression, of those sort of things. And I think most of us have some story that we carry with us, which makes this more important and more real for all of us to address. So that's one of the reasons why I'm so excited about this. I'm going to talk about.
Shawn, I like the way you put that we all have stories that we carry with us, because you're absolutely right that we just know by the data that 1 in 4 people will have a real mental health issue at some point in their lives. So that means, 1 in 4, that means it's your parents or your siblings or a child or yourself. And we're all carrying stories. And when we can tell those stories, it makes a huge difference. And actually, storytelling is a very important piece of this work around stigma.
And then that repeated idea of mental health is health. If we're going to care about our benefits, if we're going to care about sick days and those sort of things, mental health is health for many of our conversations, and trying to strike that right balance.
Right.
Now I'm going to talk about our mental health at work accreditation. URAC was involved in this for a couple of years now. And when you look at this program, you start going, well, this is different than the other things that I see. And based upon our involvement, we've built an accreditation that is based upon the same framework. So how it works is, when you do this work in your organization, there comes a point where you kind of go, how are we doing? How's it looking? And if we're investing in this, we actually think that investing in your workplace to make your workplace a better workplace is something that you want to brag about. We want to know how we're doing. It's one thing to take my own test and think about how I'm doing, but have somebody come in and actually make sure that we're doing it. So our accreditation is available to any organization. It's not just healthcare. It's 10 focus areas, just like the 10 focus areas. If you've done the index, you're well prepared to sort of speak the language of the accreditation. One of the different things about our accreditation is, when you go through it, you actually come out at a scoring level. And we believe that scoring level is reflective of where you stand in the path. And depending upon how you're doing, I think we've all seen advertisements for best places to work, or coolest offices, or those sort of things. If you're doing this work and you have somebody check it, we think you should be able to brag about it. And so this accreditation is actually meant to provide recognition to organizations that are doing this. It reminds me of the old magnet status for nurses and those types of efforts, or burnout areas that people are working on. So the accreditation is 4 scoring levels, 10 focus areas, available to any organization. And we think that this is something you should be able to brag about. So next slide, please. So the focus areas are exactly the same focus areas that you saw within the index. If you've done the index work, we say save your work, because the things that you turn in to show how you're doing in organizational culture are the things that we're going to look at. Now, it's an accreditation, so it's not just a survey, but it's actually, we come in and we verify how you're doing things and all that sort of work. And the idea being is that we're going to go through, we're going to check all of this, and we're not just going to give you your report on how you're doing. We're going to give you the badge that you've earned. to be able to say to your current employees, here's how we did, and this trusted organization came in and verified it, just like a financial audit. And maybe you're going to use it in your advertising when it comes to recruiting workers. As we all know, it's more challenging to find workers these days, and to reach out and to be able to brag about those things. Next slide, please. So the scoring overviews, when you're just getting started, you're typically going to be a level 1. You know, once you begin understanding that work and you get to be more of a systems approach to it, you're getting up to a reactive intentional approach. You actually are aiming at things that you're doing. You're not just in your silos anymore. Comprehensive standalone approach, proactively, you're designing, you're doing the work, those things. And 4 is when you've got it tied up, you're doing a great job. You're at the top of your game. And we design this because we think if you're doing the work, you want to sort of get your grade, you want to get your diploma to show where you are, but you recognize that you have places to go and better things to do. Very few organizations are up at a level 4 right now, but there's some that are 3s and some that are 2s. And so our program is actually designed to demonstrate where you sit on that. Another thing that's different about our accreditation is if you go through the accreditation, let's say you go through the index and you've got your score, you got some things that you're going to work on, and they give you the library that talks about ways to do it. And you decide, we're ready for this to be shared with the world. You go for the accreditation and you go through it and you score a level 3. Well, if you score a level 3, if you're continuing to work on it and a year from now you come back and you say, you know what, I think we're ready for a 4, you can go through the accreditation again, and we're not going to charge you like you're starting from scratch. This really is meant to document your journey and to document your improvement. And that's what our accreditation is going to be. So unlike some of our accreditations, which are just you're either accredited or you're not accredited, you're going to be accredited and you're going to have a level that you've achieved to really tell your story in a better way. Next slide, please. And once you have that accreditation, you can communicate with your employees just like you would if you had a best places to work or a best office ping pong tables or whatever award that you get. We also want you to use that in things like recruiting, because if you're looking at, let's say you're just graduated from law school and you're looking at 2 firms to join, the one that's been accredited for a healthy workplace is going to have a recruiting advantage versus one that hasn't done that. We're also going to come out, and for the early adopters and the organizations that get into this, we are going to come out and we're going to give you an award. I'm going to travel to your workplace and we're going to do the whole presentation like you just won the golf tournament, and we're going to have a delivery for you, because we want this to be internally promoted within your organization, but then also we want you to get press coverage. We want your community to recognize that you are a good place to work. And then we also have a PR kit for you to promote the work that you're doing, and see sort of what this is worth to your organization and how to get the most play out of it. You're investing in the resources, you're investing in your people, and we want your people to know it, and we want your community to know it also. So this is different than from some of our accreditations. You don't have to be in healthcare to do this. We've talked with organizations across the country and some outside of the US who have an interest in doing this, and we're very excited. We think this is that sort of shouting from the mountaintops that you're doing a great job of taking care of your people. So just want to share that with you. Next slide, please. So some of you have questions. There have been some things that have rolled through in the chat, but now we have a poll for you. This is, would you like to receive more information about the Mental Health at Work Index? Let us know your idea. Would you like to receive more information about the Mental Health at Work accreditation? This is your chance to get more information. We're recording this webinar. We're going to be sending it out to everybody. I do want to highlight a couple things with Kathy. I see she's jumped back on here. But Kathy, you shared something with us before this started about some recognition you have received, and you're not quite ready to play it all out, but could you tell us what you shared with me earlier?
Yeah, actually, while we were on online, it just got posted, so I can share that we have been acknowledged by Fast Company for the innovation associated with the work that we're doing here to advance mental health at work and the Mental Health at Work Index. So we're really honored and excited by this award and this recognition. You were talking about awards and recognitions, Shawn. They matter because it's a large community that's said that what we're doing is really making a difference and is really innovative. And so we're very excited, and thank you for the chance to share that.
Well, we're very excited that we talked long enough that it actually became public knowledge that you actually get to share the detail, and to
Thank
see
you.
the smile on your face as you say, you're getting this award and the recognition. That's exactly what we're shooting for with doing our accreditation. I love this product. I love the work that you're doing. I love the research that it's based upon, because if we can find ways to improve the workplaces across the country and across the world, I just think it's worth the investment to everything that we're doing.
Thank
Um,
you. And
if we
Shawn,
could,
I might just want to add
sure.
one comment here. Um, URAC is a nonprofit. One Mind at Work is a nonprofit. We've
Yep.
had this fabulous partnership, recognizing that doing the index and working with an organization, for us to focus on that piece and help organizations get to a point of maturity, and then avoid the conflict of interest with then additionally accrediting, but instead having a completely different organization, having URAC step up and independently review and accredit, really brings integrity to this process from the companies that we've heard from, and companies are grateful for that clarity of role around measuring and improving and working with One Mind at Work. And then when they're ready, moving over to reaching out to URAC for an independent accreditation.
Yeah, and we've had some really positive feedback about our accreditation and organizations that are interested in this. We've had some that have come through, they've done the index, they've polished themselves up and they're ready for it, and they come over to us for the accreditation. We've had some that came to us directly about the accreditation, and one of the things that we said to them is we said, go look at the index, okay? Go do that also, because of the benchmark, because of all the resources that are available. We think that it's tremendous. But Kathy and her team at One Mind are doing a fantastic job. This is tremendous. It's a great organization. Looking forward to, we're going to have a meeting coming up in a month or so. Kathy is a delight. I hope you all get this recording. I hope you all go back to your organizations and say, this is something that we need to do both for our people and for our communities. Just really thank you for your time today. Kathy, any thoughts or comments you want to throw in here as we're at 12:54? Anybody with questions, feel free to drop them in the chat, and we will answer what we can while we kill a few more minutes.
Just want to say, and by way of wrapping up, that we're at a point where we know that mental health is really critical around recruitment, retention, reputation, around organizational performance. And when it comes right down to it, it's, the people of our workplaces are our greatest assets, and they are our parents, they're our friends, they're our kids, they're who we care about. So let's put our resources to the people we care about, and that will benefit them and benefit our organizations.
Yeah, I mean, Kathy's been doing this for a while, and she heads up a nonprofit, and URAC is a nonprofit, and us working together. It's not because we're going to retire to the Hamptons in mansions or anything like that. This really is about making a difference in our communities. So we're just thrilled that you took time out of your day, or if you're listening to the recording, thank you for all of your thoughts and questions. This is a good thing, and we're very excited about it, and we hope that all of you sign up. I think at our peak, we hit 129 attendees. We've trickled down back to around 100 now, but just valuable stuff that we wanted to share with you. So thank you all very much.
Shawn,
Thank you.
Shawn and Kathy, you have one more question here. I'm going to interrupt you here.
Sure.
Talk about the process for a small organization. Because we hear Kathy say big names, but what about a group that's, I mean, we're not 60 at URAC. So what about a group that's small, that's even 20? And I think this is one of the great things about the accreditation. So I didn't want to miss it.
Yeah. Well, from the One Mind at Work perspective and the index, two responses to that. One is our members range from startups. So we have a whole startup community and leaders, founders who are part of that ecosystem. We have a large group of small nonprofits, and we actually at One Mind at Work are working with both those groups now to identify the particular needs of nonprofits, small organizations, small, medium enterprises, and the startup community, because it is very different to be in those ecosystems compared to a Bank of America. The principles of the 3 Ps are the same. How you address them when you are a less than 5-year-old company with 25 members to, Bank of America will be very different. But we work with organizations to do that. And we actually are currently piloting strategies to specifically target establishing benchmarks for these ecosystems of small enterprises and the startup community.
Yeah, the other thing I would say is that for us, when we did the index, we brought together about 5 or 6 people. We brought in HR, we brought in staff members, we brought in communications. I was there also. And there was learning that happened just from us all getting together and going through the questions together, because they would ask us a question on the index, and I was like, well, we don't have that. And HR would say, oh, yes, we do. And I was like, what? And HR sits 20 feet from me on a regular basis. And so
we hear that all the time.
Yeah. So there's actually sort of a getting everybody on the same page by going through the index and finding out what you have. Again, this is not an employee survey. This is a leadership and a company assessment as to what you have and what you do using science and objective measures. It benchmarks you, it benchmarks your peers, it benchmarks your industry, and it gives you steps to do this. I've used the analogy before, is this is not intended to be a thermometer. This is intended to be a thermostat, where it tells you what the temperature is, but it also tells you how to get to the right temperature. And that's really sort of where this can be so incredibly useful for an organization. So
thanks so much.